The use of cannabidiol in autism spectrum disorders. In-depth look of autism spectrum disorder, problem behavior in autism spectrum disorder, and the use of cannabidiol. Medical Director, Clinica Escola do Autista, Itaborai, Rio de Janeiro, Clinica Escola do Autista, which translates as the School Clinic for Autism. From Brazil, Dr. Mauro F. Cardoso Linza.
Hello, everyone. Good morning. My name is Mauro Lins. I'm a pediatric neurologist from Rio de Janeiro, Brazil. I have 30 years of experience in treating autism individuals. And I'm going to talk to you today about that experience and that fantastic experience I have been having with cannabidiol in the management of children and teenagers on the autism spectrum. So this is a brief introduction to my positions nowadays and my memberships, but my main activity right now is being the coordinator of a big institution for the treatment of autistic individuals in Brazil. So first of all, when we talk about cannabidiol and autism, it's a condition, autism is a condition where we still have a lot to learn. So for those not familiar with autism, according to the Diagnosis and Statistical Manual of Mental Disorders of the American Psychiatric Association, difficulty in communication and interaction with other people, restricted interest and repetitive behaviors, and symptoms that affect a person's ability to function in school, work, and other areas of life. It's the characteristics that lead us to the diagnosis. So it says spectrum because there is a wide variation of symptomatology, of presentation, of development in these individuals. And also as a reminder, several factors may influence the development of autism, and it's often and often comes together with other medical issues. So one point to address in autism that you're not treating only communication and interaction and some repetitive behaviors, but these children, compared to the general population and compared to their same age peers, they have a higher incidence of immunological issues, of gastroenterological issues, and also some psychiatric comorbidities and also neurological comorbidities. Those problem behaviors are more common in autism spectrum disorders as compared to other psychiatric issues in childhood and teenage years. So they also have high rates of communication deficits, anxiety, hyperactivity, and problem behaviors such as tantrums, aggression, and self-injury. What I said that it's a real burden to some of these families. So, and the interesting fact is that a problem behavior is not a core symptom of autistic spectrum disorder. So it's not necessary for diagnosis. Diagnosis is more with repetitive behaviors, sensory issues, communication, and interaction deficits. But those core symptoms can be a product of these behaviors, or they can be also a consequence of immunological issues, gastroenterological issues, and other conditions. So what the behavior looks like, those aggressive behaviors, biting, kicking, hitting, scratching, head-butting, and hair pulling. So where cannabidiol comes in the treatment of autism? The treatment of autism is basically therapy, speech therapy, occupational therapy, psychological therapy, and other therapies that work together. So my presentation here has to do with behavioral problem in those autistic children that sometimes make the therapeutic approach almost impossible. So the child is so aggressive or so agitated that during the speech therapy session or during the psychological procedures, one cannot get the best of the child because the child is dysregulated. So most of the times we start with conventional drugs, like antipsychotic drugs, which have a calming effect for some individuals. But most of the times we don't have the best results that we expect using those drugs. Sometimes we also use anti-epileptic drugs if the child has abnormalities in the EEG, or of course if the child has seizures. But in my experience with 30 years dealing with autistic individuals, I started to use cannabidiol, CBD isolates, pure CBD without THC. I started a few years ago. Now I have uh, a very interesting number of patients who have been on CBD. I would say almost 70 patients. I don't have research results of them because it's an institution and it's also my office. So due to legal procedures from the Brazilian government, I was not authorized to conduct research, but I have very interesting observations of these children and teenagers that most of the research studies don't have. For example, research studies recruit individuals that the doctor has never seen before. He doesn't know the child, he doesn't know the family. And for most of the times, the studies will present results after 60 days or 90 days of therapy. And I have children that I've known for years. I know the family. I know how the child has changed. I know that I cannot I cannot justify the benefits from placebo effects. They are really much better. So, and most of all, I have children on cannabidiol for 1 year, for 1 year and a half. And I don't know of any study that has had that kind of experience. So I'm going to comment about my results and perspectives and the possible mechanism of action. So a very interesting quote from Dr. Ethan Russo is that cannabis is very, very interesting because of the it's not generally like other drugs that we have or other pharmaceuticals that you have one drug, one target. So with cannabidiol, we can get to many targets. We achieve different results because we are dealing with different targets in the body. That's especially useful when talking about autism because an autistic child may have different behaviors because the child may be suffering from hidden seizures, may be suffering from gastrointestinal issues like pain and bloating and reflux and inflammation in the gut, and can also have a widespread immune dysfunction that probably cannabidiol will have to do with that, the benefits, the results. So my experience has to do with aggressive behaviors because the legislation, the law in my country only allows use for children that we have tried everything before and we had no results. This has changed since February. So now I have children who don't show really big behavioral problems. And I'm also using CBD for them, and they are showing benefits in language, in interaction. Sometimes the parents refer that they seem to be a different child, a much better child, and I'm going to comment about it as well. So my choice of using isolate, CBD isolates, pure CBD, has to do with some information, some from pharmacological societies and medical societies. I'm not going to talk about it today. That THC should be avoided in children as a whole. I have friends and colleagues who use THC in children in a proportion. Generally, it's 1 to 20, one THC to 20 CBD. But for now, I have only used pure isolated CBD. So also from the Child Neurology Society meeting that I attended last year, they also advise not to use THC in children. This is controversial, but we are not going to address today. I'm just talking about my experience. So, so I choose cannabidiol. Is it safe? Generally, it's very, very, very safe. Side effects are mild. I only had like 3 children who had to stop because of especially nausea. and gastrointestinal issues. And it can alter the level of other drugs, etc., just as grapefruit juice would do probably. So it's safe. This is a comment from Harvard Health Publishing and Harvard Medical School. You have the references here. So again, talking about science and personal experience, of course, we want more studies, we want more science about the effects of cannabidiol in autism. But just as a reminder, we don't have many studies. This is from 1 year ago, a PubMed search with the terms cannabidiol and autism, 14 results. This is from April, when COVID started later on, 20 studies this year. And this is from last week, 31 studies. So we don't have many studies addressing the issue of cannabidiol and autism, but we have very interesting experience. So my experience is very good, as I told you, with children, teenagers, and young adults that have been taking for months, which no study has that kind of data. So I'm going to talk about a few cases. This is a young teenager, a premature child with normal EEG, normal brain magnetic resonance imaging, nonverbal child with severe sleep disturbance, agitation, and aggressiveness. His aggressive behavior was so intense that he could not attend school. He has been on those gluten-free, casein-free diets for 1 year, no results. Previous medications, anticonvulsive drug, antipsychotic drug, antipsychotic drug. No results. At first visit, he was using a combination of two antipsychotic drugs in high doses. I started CBD, only 25 milligrams per day with gradual increase over the following weeks. Generally, I increased other 25 milligrams per week. Maximum dose for my patients, 200 to 300 milligrams per day. His aggressive behavior ceased completely. That the antipsychotic drugs were successfully weaned. Another case, another female teenager could communicate basic needs, generalized aggressive behavior, self-injurious behavior, also with a combination of antipsychotic drugs and anti-epileptic drugs. First visit, he was using an antidepressant and two antipsychotic drugs. We started with the same protocol, current dose 250 milligrams per day, no more aggressive behavior, no longer on the antidepressant, and the antipsychotic was reduced. So now a female, 22 years old, this one had epilepsy, aggressive behavior with no apparent reason. She would break the whole room, the objects in the room, break TV and all that. She was using extensive combination of drugs when she arrived, 1, 2, 3, 4, 5, 6 drugs. So for anxiety, for convulsions, and also for behavior, those antipsychotics. We started with the same protocol, current dose 200 milligrams per day. We could remove some drugs, others we are still trying to work on that. She lost 20 pounds, so a side effects of that combination of drugs generally is weight gain with complications that will come along with weight gain. She lost 20 pounds, maybe because she was off those medications, but we now know that CBD can also help losing weight by itself. So her aggressive behavior improved tremendously. She never broke her room again and the objects in the room. And also she had improvements in language, attention, and cognition. So another boy, 7 years old, very aggressive and intense self-injurious behavior. A child that once beat his father's hand during the appointment. There was blood all over, so a very severe child, non-verbal, no seizures, with a sensory processing disorder, different combinations of drugs in the past, 5 months now, 6 because I had to update, on 500 milligrams per day only of CBD, 90% reduction in aggressive behavior, able to respond to therapy. He could not attend therapy anymore. No longer on the drugs. It's only with another antipsychotic drug. but in a very low dosage. So also now another female teenager. This was very severe. She had broken like 5 TVs in the house during the last year. Combination of drugs. Sometimes parents had to call an ambulance. She had to be to the yard, a visit to the emergency room due to aggressive behavior. She's 12 years old, but she's big and strong. We started CBD, no more ER visits, much better with aggressive behavior, better communication, interaction, and better sleep. So this is another child with also very, very severe behavior. Now he's on the dentist, no sedation. He's just doing fine. He's awake. This would be impossible to imagine before he started CBD. He could not attend therapies anymore. And now he's at the dentist, something that is scary, even nice, and he's doing okay. Mechanism of action can be quite confusing. We really don't know, but we can speculate. Uh, we know some studies have shown good results, as I told you. We know it can be, one of the effects can be as an antipsychotic drug. It works as an antipsychotic drug, but we don't know the mechanisms. Also antipsychotic properties, but we don't know how it works on the chemical and cellular level. But it can be an effective, safe, and well-tolerated antipsychotic compound, especially for autistic individuals in my experience. We also know, as I told you, about the gastrointestinal symptoms and issues, which are much more common in autistic children than in the general population. And if you look deep into the literature, you see that cannabidiol and other cannabinoids can be very helpful in GI issues, in GI disorders and diseases. Also, cannabidiol reduces intestinal inflammation. Cannabidiol can have a potential for inflammatory bowel disease. Cannabinoids in the gut also showing benefits for the use of cannabinoids and its association to gut issues. And we know that autistic individuals, they have problems in the gastrointestinal system. Also, role of endocannabinoid system in the brain-gut axis. Also, cannabis and derivatives in gastrointestinal and hepatic disease. As I told you, some of these children also have immune dysfunctions. They get sick easily, and it seems that their immune system is always working. It's always on fire. Some of these children, they are really disrupted. They are very aggressive. They cannot concentrate. They are always agitated, and I had good results with them as well. So we have the literature to back that, right? So cannabidiol effects on inflammation. Now, one important issue is that some people are promoting CBD cannabidiol as a miracle solution for autism. Autism, the approach is therapy, but sometimes these children have other issues that they need our help. So we have to consider that if CBD is effective of certain symptoms in autism, it's not treating autism, it's treating symptoms of autism. If we have better candidates for these treatments, although I have very nice results for some of those patients I showed you for the family, it's almost a miracle. Even for me as a doctor working in pediatric neurology for 30 years now, so I have never seen any kind of drug with big results like that. Sometimes immediate results and very impressive results. But does it happen to all of my patients? No, unfortunately not. I have a few individuals that they do not respond to CBD. Most of them respond to aggressive behavior, but for hyperactivity, agitation, I have a few individuals that do not respond. Also, it's also promoted as a sleep relief that induces sleep. You have a better quality of sleep, but this doesn't happen with all of my patients. So one idea of us, I have a group of friends. We have worked at the University of California with stem cell research. This is me from Brazil. We think that maybe with a good genetic workup, we may tailor individuals that will respond better to CBD. There's a kind of work like that underway. I cannot disclose details, but we see that the list of genes associated with autism just grows and grows from 78 single genes related to autism in 2019, 2017 to over 140 in 2019. 2020 in January, it's growing now 156 single genes related to autism. So in a couple of years, it's doubled almost the number of genes associated. And maybe having a good workup of genes of these individuals, a good examination, we can know which individual will respond to CBD or not. And now to finalize, we have to remember that during the period of in utero development, things may happen that bias our system weakly or strongly, including genetic vulnerabilities, maternal metabolic syndrome, environmental exposures, hormonal imbalances, inflammation, etc., etc. But this is not the end. This is not mathematics. Maybe when the child has had environmental issues related to autism, or the genetic conditions related to autism, what will happen in the future is not defined. That depends on whether the subsequent influences aggravate the situation or are more protective and promote repair. For me, CBD can even be protective and promote repair. So it's a new area for science to understand how CBD works, and especially how CBD works with those amazing results that I have seen in the autism population that I take care of. And just to finalize, stopping to think in other strategies to promote creativity in science, something that we need nowadays. And also, we have that lost art of today that we want to call thinking. So people don't have time to stop to think what they are doing and how things work most of the time. So thank you. A beautiful picture of where I live in the outskirts of Rio de Janeiro. And I thank you for your time. Now, if you have any questions, I'll be happy to answer.
Excellent. Thank you so much for all that useful information. We have one question from the audience based on the information you provided. It sounds like CBD successfully treats multiple symptoms with just one application of CBD compared to multiple medications. Therefore, would you say that not only CBD is not only more effective, but also more affordable than conventional medicines in most cases?
Yeah. In terms of being affordable, it depends on how much medication the child or the teenager is taking, and what price do you pay for CBD in your region also, right? Because depending on the weight of the child or teenage, we'll have to use more CBD, of course. But one thing that we have to be aware of is that the results can be so impressive that it will compensate even if it's more expensive, because that traditional combination of drugs may result. Stop sharing the screen. So that traditional combination of drugs can be a burden to the health of the child. So you have side effects, you have problems in the future, you have problems with weight gain and the consequences of weight gain, sometimes with diabetes, issues with cholesterol and all that. And in the beginning of the question, yes, CBD, not for all patients, but even early on in the treatment, some families relate very impressive results with just 1 week of treatment, which is totally unexpected. So yes, we see very impressive results with a single drug that we can wean the patient of other drugs just with a few days of treatment. And nowadays, I'm not using children that have problems specifically with language, interaction, concentration, and these families are also reporting very good results. And even in therapy, sometimes the psychologists would say, oh, is it a different child? Did you bring a different child, another child to the session today? Because the child seems to be a new child, just like woke up
That's great.
to a new experience in the world.
That's fantastic. So basically, it sounds like even if it is not as affordable as maybe other conventional drugs right now, the benefits of the side effects are probably more than the cost of the drug itself or the CBD itself, the long-term side effects, right?
Yeah, the long-term side effects, sorry if I cut you. So the long-term side effects and the beauty of it is that you see results. So the child is getting better, life is going to be easier. For those children that could not attend school anymore, any longer, they are attending school again. So they will benefit, they will learn, they will interact with their peers. So, and also less time of therapy. So if the child was going to be on intensive therapy for years, maybe that will be shortened. So overall, even economically speaking, if you spend more, it's an investment. It's not money down the drain because the child's getting better.
Yeah, definitely. Nausea and fatigue are very minimal compared to other side effects from the other conventional drugs. Okay, thank you so much for your time. We've got to move on to our next speaker. We really appreciate it, and we'll see you for our discussions later.
Okay, it's a pleasure. Thank you. Bye-bye. Have a good day. Bye.